Hello, I'm Dr. Smita Bhatia, and I will be, along with Dr. Landier, giving you a brief presentation on breast cancer survivorship. We have no conflicts of interest to disclose, and the learning objectives at the completion of this module, the participants will be able to discuss the rationale for providing long-term follow-up care for breast cancer survivors and identify the key components of breast cancer survivorship care, and explain the referral process for UAB's Next Steps Breast Cancer Survivorship Clinic. Now, why should we have a clinic devoted to breast cancer survivorship? Most people diagnosed with breast cancer today will become long-term survivors. This is because there are significant advances in diagnosis and treatment, and there's an increased expectation for high-quality survival. Indeed, Dr. Julia Rowland from the National Cancer Institute has made a very astute observation that being cancer-free is not the same as being free of cancer. Cancer survivorship is a distinct phase of cancer care. It includes psychosocial coping, surveillance, long-term follow-up, detection and management of long-term complications, also known as late effects, and then health promotion. The cancer survivorship care includes need for continuing follow-up. Survivors and healthcare providers need to be aware of those health risks, and then primary care providers may be and often are unfamiliar with the problems faced by cancer survivors. There are significant late effects that can develop after breast cancer treatment. These include fatigue and weight gain, neurologic complications including cognitive impairment, often known as chemobrain, and peripheral neuropathy, musculoskeletal and soft tissue involvement with osteoporosis and lymphedema, cardiopulmonary complications such that patients can develop heart failure and pulmonary toxicity, and then reproductive complications including infertility, premature menopause, and sexual dysfunction. And then, of course, the psychosocial complications including anxiety and depression, fatigue, and altered body image. These all place the patients at risk for late effects, and these differ for individual survivors depending on the treatment received by the patients and other host factors. And now I would like to turn the podium over to Dr. Wendy Landier, and she will describe the key components of cancer survivorship care. Dr. Landier?
Thank you, Dr. Bhatia. I'm Dr. Wendy Landier. In cancer survivorship care, we have three main key components. These include clinical care, psychosocial support, and education. At UAB, we have a specialized clinic for cancer survivors known as the Next Steps Breast Cancer Survivorship Clinic. We address all three components of care in our clinic, starting with clinical care. We use an anticipatory, risk-based approach to allow us to identify late effects that survivors may be at risk for based on the particular treatment that they received. This allows us early detection and management of late effects, as well as referral to subspecialists as needed. And the care is provided by a nurse practitioner specializing in survivorship care. The clinic also provides psychosocial support in the form of a dedicated social worker who provides evaluations and referrals to local resources as indicated. The clinic provides extensive education for survivors. The education is tailored and is focused on health promotion. It is specific to the therapy each survivor received and personalized to that individual survivor. This is an example of the guidebook that a survivor would be given in the clinic. The guidebook includes a personalized cancer treatment summary, which the nurse practitioner reviews with the patient, providing details about all the cancer treatment that particular patient received, as well as a personalized survivorship care plan and personalized health education materials. In terms of referral, patients are eligible for the clinic if they have had a diagnosis of breast cancer, they are at least 12 months from diagnosis, they have completed all of their planned cancer therapy with the exception that they can still be receiving ongoing hormonal therapy. The referral process is straightforward. For clinicians affiliated with UAB, this can be an internal referral completed through the electronic medical record or impact, and through submission of an internal specialty referral for the Breast Cancer Survivorship Clinic. Patients can also self-refer to the program, and clinicians can provide direct referral if they are outside the UAB system by calling area code 205-638-2155. So finally, what can you as a clinician do to promote breast cancer survivorship? Well, first is to acknowledge survivorship as a distinct phase of cancer care. Next, it's important to recognize the unique needs of breast cancer survivors and to identify breast cancer survivors in your practice. And finally, to refer breast cancer survivors for specialized follow-up care. Thank you.